Hey, it's Dr. Josh, your dry needling expert here in Tampa, Florida. In today's video, I want to answer all the questions that you might have when it comes to dry needling. So when it comes to dry needling, I've done like 30,000 treatments. I do 15 to 20 of these a day, so I do a whole lot of it, and there's a lot of really common questions, so I want to answer this for you right now. So we'll cover how dry needling works, what it's used for, the risks, the benefits, how many sessions you might need, and the cost, okay? So let's just dive in right now. So first of all, what is dry needling? How does it work? Those are great questions, they're really common questions. People don't really have much experience with it. So let's just jump in. So dry needling is where we use a little acupuncture needle. Here's what one looks like. They're really small and thin, there's no hole in them. So they're a lot different than a needle you might get a shot for. We use these little tiny needles and we insert them into trigger points. Now, trigger points are little tight bands of tissue, right? And they can restrict range of motion and they can cause pain, and they can refer pain to other areas in your body, right? So a good practitioner will perform a good orthopedic hands-on physical exam. They'll palpate, they'll check range of motion, they'll see if there's referred pain. If they can recreate that pain, then we know we can make a huge difference when it comes to dry needling. And with dry needling, we go into those trigger points and our goal is to deactivate them. Now, how does it work? It's kind of a complicated question. It's hard to answer in just a couple of minutes here, right? There's a bunch of different pain models that we can kind of pull from. There's a chain gun where there's basically irritated nerves spit off chemicals and gunk up tissue and causes these little trigger points. There's Travell's model where these trigger points develop and they can cause referred pain. I kind of blend everything, and what we find though is that if there are active trigger points, if we press on tissue and it causes pain or refers pain somewhere, then that is a good indication that we can make a huge difference with dry needling. So it's a really effective technique that we can use for basically any type of musculoskeletal pain condition or anytime there's limited range of motion, especially with movement. So dry needling, it's just a great technique for any type of pain basically. Use it for back pain, neck pain, knee pain, shoulder pain, hip pain, foot pain, elbow pain like tennis elbow, carpal tunnel. Basically any type of pain condition generally is going to respond relatively well to something like dry needling. So some of the risks that are associated with dry needling, well, look, honestly, the risks are pretty low when you go to an experienced practitioner like myself here in Tampa, Florida. Now, there are going to be varying levels of experience when it comes to dry needling. The standardization across America is a little bit wonky, so it's going to be on a state-by-state level in terms of how much education your practitioner actually needs to perform dry needling. It's going to be done by acupuncturists. They're going to have the most experience. Chiropractors, physical therapists, those are going to be the main practitioners that are performing dry needling. So you want to just make sure they have a lot of experience and they do a lot of this every single day. Someone like myself, I see 15, 20 patients a day. I've done that for almost 10 years, right? So I've done a whole lot of this. So you want to go to someone that basically where this is their main tool that they use. You don't want to go to a practitioner that only uses dry needling a couple times a day or a few times a week. You're not going to have the same results that you get when you go to someone like myself who literally only puts needles in people to help them feel better. So you want to make sure that you go to an experienced practitioner. Your risk levels are going to be much lower. The biggest risk factors though are a little bit of tenderness at wherever we do perform dry needling, maybe a little bruising, a little bit of bleeding, little very minuscule amounts, like I'm talking a couple drops. And the biggest risk is a pneumothorax, which is a puncture of a lung, right? So there's a little area here on the front and the back where it can be a little bit dicey if you don't have the experience level to use the correct techniques. But when performed by an experienced practitioner, totally safe. The benefits are freaking amazing. I mean, honestly, I see people every single day where we're able to prevent major surgeries with just simple dry needling interventions. So the benefits are it can absolutely change your life and get you out of pain and get you back to moving and feeling like yourself in a relatively short amount of time without surgery and without medication. So benefits are exponential for the vast majority of pain conditions. When should you get dry needling? Well, you should get dry needling whenever you're experiencing any type of musculoskeletal pain, which is going to be most pain problems that you're going to experience throughout your life. Those little strains, those little tweaks, when you throw your back out, if your knee's uncomfortable, if your foot's hurting, if you got a little tennis elbow, then those are great times to get dry needling. The sooner you come in, the quicker we can make things feel better. The longer you've had a condition, the more chronic it is, obviously, the more difficult it is to resolve or to move it in the right direction of feeling better. So the sooner the better when it comes to pain. How many sessions are you gonna need? That's gonna depend on your physical exam. That's gonna depend on the specific conditions you're experiencing. But a good seasoned practitioner will be able to give you a good ballpark after you come in and get an exam performed by them. But expect, anywhere between a few treatments to 20, it's really gonna range just depending on the severity of your pain, the chronicity of it. So anywhere from just a few to a whole lot. So it can really range. In terms of cost, well, that's going to vary depending on where you're at throughout the United States. Here in Florida, my rates are anywhere between $75 to $125 depending on what area we're treating and how many regions we're treating. But somewhere in that range is a good ballpark across the country. There might be some insurance coverage depending on your state, depending on your individual insurance policy, but you would need to call your insurance company to have them verify that. It's still a pretty new treatment in America, so treatment's pretty spotty. Coverage is pretty spotty. So you would have to call your insurance company because there's a gazillion different policies and they all have different things that they cover. So, but expect to pay out of pocket for most dry needling, or especially from a good practitioner, because insurance really tries to limit the type of treatment that is provided or the amount of areas that actually get treated. So most practitioners that are any good usually are out of network when it comes to insurance coverage. So hopefully that answers most of your questions when it comes to dry needling. Those are the common questions that people have when they come into my office. So we covered what dry needling actually is, how it works, some of the risks and the benefits of it, when you should get it, number of sessions you might need, and the cost. So if you liked this video, you want to know more about dry needling, then reach out to me at drhanson.com and I'm happy to help you.